What's up, you guys? This is your boy Miguel giving you your daily dose of radiation. Today's video, we're covering why I chose X-ray tech school over nursing school. So to give you some context, I am an X-ray tech, been doing it for 4 years, 7 on, 7 off, night shift, baby. So as far as me personally, I have two views on this. I, of course, will be Team X-ray, but my lady, who's a nurse, I've asked her many questions about nursing school, and even as I was going, I've seen, because essentially where we were, you kind of were all the medical, were kind of huddled into one. So you got to see a bunch of stuff. Even at clinicals, you would get to see all the dynamics and stuff. And in short term, each profession has their own stuff, their own challenges, and their own stuff that is hard. Each one has, like, they're not easy. To become a nurse, to become X-ray, it's just not easy. Like, there's a set level of regular college courses, and then when you get into your major of the medical ones, there's a whole different beast. It's a different dynamic. I would say that X-ray classes have, as far as workload, it's a semi more manageable compared to nursing school, based off of the knowledge I've acquired from my wife, who's a nurse, because she would tell me that she would, like, even clinicals, she would have to go for certain clinicals to wherever she was going, get a report on all the patients, learn all their medicine, learn all their history, learn so much about these people that she will see the next day, and still deal with school stuff and still deal with other stuff going on. Versus me in X-ray school, I don't gotta know nothing about whoever. It's just random. It's just whoever shows up gets the job done. That's it. I don't have to learn any history and stuff about these patients. Like, I would tell her, and I'd be like, yeah, I can just show up 8 o'clock, and if they want me in the main, I may look and get a brief little, okay, we have so-and-so getting this done. Or if you're in the ER, it's literally just random. You just, the chest x-ray, just beep, versus hers, to give medicine, to give this, to get checkoffs. Even that, to get checkoffs, your professor has to be there to sign you off. To get stuff. Versus my professor would only go maybe once a semester if I was lucky. And even then, they wouldn't even be watching you do the x-rays. It would just be the techs. So, like, you wouldn't even have to deal with that stress with that wise. I will say that as far as the amount of people who get in, there's more availability for nursing and like college-wise, there's more places that offer nursing compared to x-ray. So I could see how when they're like, oh, we only accept like 25 techs to get into the school versus like 50 for nursing school, you could see how, like, it would be more easier to get, well, not easier because both are highly competitive, but there's a greater chance of you getting in compared to 25, like almost half. Like, even at my junior college where I went to, like, it's literally double the amount. Granted, hers started off with 50, and by the end, they graduated only 11 or 15 graduated. And I'm like, well, shit, we started with 20 and we ended up with 11, or how many? 11 or 15, I forgot. So, like, we ended up with the same amount of people, but they had a higher bunch. So you could see how harder it is, because they had to deal with medicine. They had to deal with, like, a lot of other variables that we really don't deal with as much. And even the boards and NCLEX and all the other stuff, I could see how it could get more challenging. I've seen more people cry in nursing school versus X-ray tech school. So yeah, for those who are dabbling in both worlds, my biggest advice is to do your research, understand why you would want to go to each profession, do a little just brief. If you're one of those people, oh, I want it for the money, I'll do the hard work. I'll be honest with you, X-ray techs, just basic X-ray techs, we get paid a little bit less than nurse. Nurse gets paid a few dollars more. I will give nursing that. I make more money than my lady because I do night shift, so it's different. But they do make more. As far as like if they continue their education to like RN, BSRN, and all the higher things, the only way I could compete to my lady going to that is if I go to CAT scan or I go to IR or cath lab, whatever. Then I could compete with her pay. So, and then also as far as job availability, they have a little bit more compared to ours because we're kind of limited on where we could go. So that could be a deciding factor of why you would choose nursing over X-ray tech. I personally, if you want my opinion, I love bones. I wanted to look at dinosaur bones, but my parents wouldn't pay for that, so I kind of was like, well, there's X-rays. So I ended up going with that, and I do not regret it at all. I can say I work at the medical field, and I help change people's lives. Maybe not as deep as my lady does, she does day to day, and she gets all the credit. I will let her get all the credit because she deals with way more stuff than I do. But I would say that I am proud to be an X-ray tech, and I enjoy my job. So if that helps persuade you, and if you check out my channel, I cover almost any aspect, or will cover any aspect. Like I have like this whole thing of just different little individual little topics, very niche, that no one on YouTube will cover. Nursing, maybe they will, but X-ray, no one does. And I do it simply because I wish to educate the people about what we do, because some people don't know, and there's certain aspects that don't get covered in our field. And as a student or someone who wants to join our profession but is curious to know, but there's like right now you can go on YouTube and you can just try X-ray and you'll just find the basic videos, day in the life, or what it's like, or like there's basic stuff, but never in the nitty gritty situational base, like what happens if you mess up an X-ray order? How do you fix it? Like, how do you change the images? How do you autocorrect? Like, there's certain niche, like very niche subjects that no one's gonna cover. So that's where I come in, and I will educate y'all in all kind of niche. So yeah, it's been your boy Miguel. See you on the next one.